Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the last Public Health Weekly update for the year of 2022. This week, I'm going to answer a question that people have asked me, which is, what are the top 3 public health news stories for 2022? In descending order of importance, I would say the third is that COVID-19 is still here, but the pattern has changed. You will recall early on in terms of deaths, the first year we saw these recurring spikes of thousands of deaths a day. We saw the same pattern in the second year, but with slightly lower spikes, but still very clear in thousands of deaths a day. But for the past 8 or 9 months, it's been pretty level. Now, this doesn't mean it's gone away. We're still seeing 300 to 400 deaths a day, but the pattern has clearly changed. Now, some have suggested that this may be because of mutations in the virus, but most of the data suggests that it's from immunity from the vaccine or previous infections. A report just came out from a group in Italy. They examined more than 18 million people across the world, and they found that vaccination cut in half the risk of severe COVID symptoms. And so while we may be seeing more cases, we're not seeing the serious cases, the hospitalizations, and the deaths. Now, that doesn't mean it's not going to come back. Historically, the worst peaks have been in January. But at least at this point, it suggests that the vaccinations are helping us. A report earlier in the year, and it's not peer-reviewed, but it's an interesting one. It suggests that had more all Americans been vaccinated, we would have had about 300,000 less deaths. Now, even if that's overestimating it by a significant amount, you do see the importance of vaccination. And you may have heard that there's a grand jury being formed in another state to look at any potential misconduct associated with the COVID vaccine. And I certainly hope they look at misinformation that was spread by elected officials, media personnel, and others to see if that's had any impact on the number of deaths in our country. So the second story for the year that I think is important, of course, is the war in Ukraine. I mean, from a public health standpoint, obviously tens of thousands of deaths, millions and millions of people, either refugees or internally displaced folks. In fact, it's been estimated that almost half of the children have left their homes. And that's a significant public health implication. But as you've heard in the news, there's also sort of downstream implications, particularly on the world's food supply. A report just came out from the United Nations that reports that Russia and Ukraine provide about a third of the world's wheat and barley. I mean, they become the breadbasket, the servers food. And of course, during a conflict, this ability to export food has gone down considerably. And this report points out that in developing countries, a greater percent of income is spent on food. And when the price of food goes up, there's a very real risk of famine and starvation. And this exacerbates, so the rising prices seen here exacerbates what we're already seeing in terms of drought and unprecedented heat waves in other countries. But perhaps the greatest impact, I think, on the war is the psychological trauma, not just the people, but all of us who grew up at a time when we never thought we would see a World War II type invasion of tanks into another country, or perhaps even worse, a World War I type entrenchment where neither side can move forward because the other side is so deeply entrenched. And I think it's also made worse by the fact that there are even folks in our country who are defending the Russian invasion. And we're reminded that there's never a time in the modern world when it's okay for one country to unilaterally invade another. There are plenty of other mechanisms, the legal system, and so on, by which global conflicts can be resolved. And I think that's had a huge psychological impact on all of us, calling into question the very things that we believe about the world today. And finally, I'd say the number one news story for 2022 from a public health standpoint is an awareness of climate change. Now, I say an awareness because we've known for a long time that temperatures are going up. We've known for a long time that all the reasonable predictions say they're going to keep going up. We've known for a long time the impact of heat on human health. We've known about melting glaciers, ice packs, increased droughts, wildfires, impact on agriculture, disease spread, human habitat, energy demand, and so on. All of that's new, but all of a sudden this year, people are paying attention to it. And we've seen headlines all over, mostly about the heat waves earlier in the year, the unprecedented temperatures that are occurring around the world. But we're also increasingly paying attention now to sea level rise and the fact that this is not just a hypothetical issue, that it's a very serious issue. It's going to impact a lot of folks. We're paying greater attention to droughts around the world and the number and extent of places that are going to see droughts in the coming years. We're paying greater attention to wildfires and the impact on human conditions. And the United Nations has called climate change the biggest health threat facing humanity today, and that they anticipate 250, 250,000 additional deaths from heat-related issues in the coming years. And this will have a huge impact on people having to migrate, to move to other places, and many will move to urban areas, exacerbating the many problems that already exist there: unemployment, spread of communicable disease, lack of access to food, and somewhat ironically, increased exposure to heat-related stress. So why are we suddenly paying attention to all of this? Why am I saying awareness of climate change? Because really, this issue of the denial of climate change, and for years people have been calling into question whether it really exists or not. But all of a sudden, even the World Economic Forum is saying that climate denialism may be dead. And so it's not that the science has changed. It's not that the facts have changed. It's just that people are increasingly aware that the counter arguments are fallacious and not without merit. So the three challenges, three major public health stories for the year: that COVID-19 is still here, there's a war in Ukraine, and the awareness of climate change. And one of the things they all have in common is that we've been misled. There have been people out there who've been saying things that aren't true. I'd never begrudge anyone for believing something that's not true. I do begrudge people who say it for economic profit or personal aggrandizement. And I think the take-home lesson from 2022 for all of us is that we must always seek the truth, seek out the best information we can find. I'd like to thank Derry Young for editing, producing, adding captions, and posting this video and all the others over the past 2.5 years. I'd especially like to thank all of you. The comments I get from people keep me going here and make me realize that even if the numbers aren't great, there is an interest in having good, accurate information. And as we go into 2023, please let me know the issues you'd like to see covered. Until next year, I hope you have a wonderful holiday, a happy new year, and please be well. Thank you.